So can you tell me a little bit about the time frame from when you were feeling symptoms to when you first went to the doctor? And then also from the time you saw the doctor, how quickly till you actually got to surgery?
So I started feeling, like I said earlier, I had a lump in my right side, and I had that for probably a year, but it didn't grow. It obviously did. But from the time I started to not feel very well until I saw my doctor, is probably a month and a half. And then from there was when we started to rule out other possibilities that it could be. When they did do the ultrasound, they found my large cyst. It was a week later I had it out. So.
Good. And that's actually fast, because
Yeah.
if you and you went to a GYN oncologist.
My primary care sent me to GYN oncologist, and she got it. I saw her, and on Friday, I saw her Wednesday, and on Friday I was in surgery.
And so they, you had all of these symptoms, and then you had what to actually diagnose that you had something there?
I had a urine test and an ultrasound, and the ultrasound is what they noticed. I don't know how to say it. They obviously noticed my really large cyst during that time.
Okay.
Yeah.
And did they run some labs too? Did they do the tumor marker labs?
Right after my scan, they did do the tumor marker labs, and I also got a CAT scan.
Okay.
Yeah.
Were the labs abnormal?
Nothing that was a red flag. The CA-125 wasn't that elevated. It was still within normal limits.
Okay. Okay. Was the CT scan suspicious?
Yes, that's where my oncologist noticed that there was an area that could potentially be cancer. So she labeled the borderline until after my surgery when she could figure it out.
But my diagnosis actually came from my routine annual GYN appointment. So after my surgery and diagnosis, I had several friends run get their annual GYN appointment.
And that's probably more, in my opinion anyway, that's probably more rare to diagnose it at an exam than it is another time, only because the ovaries, as we know, are very small and very hard to feel, very hard to feel. So that's great that it was diagnosed that way or picked up that way. Are there other ways that your ovarian cancers were picked up?
Well, for me, I was actually lucky that my pain was so severe that I was rushed to the emergency room. And I've never experienced pain like that. So during that time, they did the CAT scan, which showed that small cyst from 2 months earlier was now the size of a grapefruit. And that's when they scheduled my emergency surgery. But I was never told or led to believe at that time that they thought it was anything to do with ovarian cancer. They just thought the cyst had gotten so big and was putting so much pressure on my ovaries that they were going in to remove the cyst, was the plan.
Okay. And yours was picked up on exam?
Oh, cute, yeah.
Imaging?
She felt something suspicious at the routine GYN exam and then ordered an ultrasound. And the ultrasound showed a complex, what they thought was a complex cyst. But then they ordered CA-125, and my CA-125 number was 47, so it was slightly elevated. And so then I went to the GYN oncologist.
Was your surgery with an oncologist?
So my surgery when I went in was with my gynecologist, but when he removed the cyst, they found the ovarian cancer, so they let me stay under and called in the oncologist to complete my surgery.
So
and I was telling Meg that I was lucky, just happened to be in the hospital I was in and just finished surgery.
So they sent your specimen immediately to be looked at?
Yes.
Because they thought it was suspicious?
Yes. But my oncologist is the one who completed my surgery, did everything at that time. Well, and they did tell me that day that literally my oncologist, he calls me lucky because he was literally just finishing the surgery and was at the hospital. And so, but normally they would have sent me home and I would have had to wait to be scheduled.
Yeah, so my GYN definitely had a different approach. And the minute she had told me when she found the cyst, and she still thought it was benign, but she said she had a rule. If my CA-125 is over 30, she would refer me to a gynecological oncologist. So my next appointment was then in that world, and that surgery was scheduled initially with that doctor. Interesting. Different. It's, that's actually something I've learned. I don't know about you guys, but it's not, it's a nuance.
It's not by the
There's-
book, right?
Yeah,
No.
there's nuances, there's a case by case, you know, it's not one size fits all, it's not one way every person.